Hi everyone, it's me Jackson, back again for our second episode of 𝗢𝗨𝗧𝗛𝗙 info series affiliated with Pantai Hospital Penang and 𝗢𝗦𝗧𝗘𝗢𝗢. Thank you for following us on this episode, which our consultant orthopedics and traumatology surgeon, Mr. Boon, which he will be sharing with us on the symptoms of OA and how knee OA is diagnosed. I'm as excited as you are, so let's listen to what he will share.
Symptoms of knee OA, the most important one is always pain, pain, and pain. Okay, I always categorize the pain into three categories: mild, moderate, and severe. So for the mild pain, usually patient will suffer pain only after very active activity, example, exercise or walking for long distance or stand for a long time. Okay, the pain is always mild and tolerable. So the moderate pain is always pain needs some medication, means the patient will think of taking painkiller to reduce the pain. While the severe pain means that the pain itself will change patient's lifestyle. Example, if patient go for morning walk or jogging every day, but because today morning when she wake up, she feel the pain in the knee and she change her mind. She don't want to go for the jogging. This is called something called severe pain that change the lifestyle. So pain is always very important symptoms of knee OA. The second symptom is always stiffness. Stiffness means that early morning, when the patient wake up in the morning and he suddenly feel the knee is very stiff, means that she unable to fully extend or fully flex the knee, and this will affect her movement. So stiffness is second symptoms of knee OA. Deformity is another symptoms of knee OA. You know, sometimes when you go to the market, you go to the shopping mall, you will see some old people with the knee bent inwards. This is called genius varus, or bent outwards. It's called genius valgus. This kind of knee most likely is due to knee OA. And if this patient who suffer from this kind of deformity, most of the time they need surgery to correct the deformity. To diagnose a knee OA, first I need to examine the knee and followed by X-ray examination. Let's look at the X-ray. If you see the first X-ray, you can see both knee joint space is reduced, while the one in the right hand side, the joint space is reduced, and at the same time the inner part of the knee is actually very near to each other. This kind of knee patient will suffer very painful knee. However, the range of motion is fairly preserved and there's no deformity in this kind of knee. If you see the second slide, in this slide you can see the inner part of the knee or medial side of the knee is actually knocking each other. This knee will have a very significant deformity, means the knee is bending inwards and patient will have difficulties in walking. Or the last one, you can see the inner part of the knee already fractured. This small piece is actually fractured due to knee osteoarthritis. It's not a common presentation, however, it do happen sometimes. This knee, patient is unable to weight bear and he needs wheelchair to ambulate. So yup, now I want to examine your knee. Can you lift up your knee? Up, very good. Can you bend your knee? Bend as much as you can. Okay, stop. So I'm checking the range of motion of the knee to see whether is there any stiffness of the knee. Okay, Mr. Yap, now can you bend the left side? Same with the right. Okay, very good. Let me know if you feel the pain, huh? So now I examine the joint line. This is medial or inner joint line. We see whether his patient will suffer pain or not. Osteoarthritis patients, sometimes they will have pain when you touch this side. This one is outer angle of the knee or lateral aspect of the knee. Same, we palpate, we touch and see whether there's any pain when we have a deep touch or not. Do you have any pain? No, very good. Next one, we are checking laxity. Okay, very good. We are checking the ligament laxity and see whether the ligament dysfunction or not.
I think what Mr. Boon shared was insightful. I hope that from this episode, you're able to recognize and monitor on your OA symptoms and learn how OA is diagnosed. In our final episode, Mr. Boon will be sharing with us on the most important topic, which is how to manage OA. If you would like to watch our first episode on what OA is, kindly check out our Georgetown Pharmacy and Wellings Pharmacy Facebook page. And remember, we are having a referral program affiliated with Pantai Hospital Penang with complimentary X-ray scan from Pantai Hospital. If you need extra information, kindly check out our caption. See you again!